Welcome to my channel. Now today's presentation is part 1 of nursing practice questions and answers about reproductive system. Now let's start with the first question. The nurse is preparing to teach a prenatal class about fetal circulation. Which statements will be included in the teaching plan? So select all that apply. So these are the options. Option A, the ductus arteriosus allows blood to bypass the fetal lungs. Option B, one vein carries oxygenated blood from the placenta to the fetus. Option C, the normal fetal heartbeat range is 160 to 180 beats per minute in pregnancy. Option D, two arteries carry the oxygenated blood and waste products away from the fetus to the placenta. Option E, two veins carry blood that is high in carbon dioxide and other waste products away from the fetus to the placenta. Now for this question, the correct answer is options A, the ductus arteriosus allows blood to bypass the fetal lungs. Option B, one vein carries oxygenated blood from the placenta to the fetus. And option D, two arteries carry the oxygenated blood and waste products away from the fetus to the placenta. Now let's move to the rationale. The ductus arteriosus is a unique fetal circulation structure that allows blood to bypass the non-functioning fetal lungs. Oxygenated blood is transported to the fetus by one umbilical vein. Two arteries carry the oxygenated blood and waste products from the fetus, and one umbilical vein carries oxygenated blood and provides oxygen and nutrients to the fetus. Now let's move to the second question. The nursing instructor teaches a group of students about fetal circulation and then asks a student to describe fetal circulation, specifically the ductus venosus. Which statement by the student indicates an understanding of the ductus venosus? So these are the options. Option A, it connects the pulmonary artery to the aorta. Option B, it is an opening between the right and left atria. Option C, it connects the umbilical vein to the inferior vena cava. Option D, it connects the umbilical artery to the inferior vena cava. Now for this question, the correct answer is option C. It connects the umbilical vein to the inferior vena cava. Now let's move to the rationale. The ductus venosus connects the umbilical vein to the inferior vena cava. The foramen or veil is a temporary opening between the right and the left atria. The ductus arteriosus joins the aorta and the pulmonary artery. Now let's move to the third question. A pregnant client tells the clinic nurse that they want to know the sex of the baby as soon as it can be determined. The nurse plans to inform the client that they will be able to find out the sex at 16 weeks gestation because of which factor. So these are the options. Option A, the appearance of the fetal external genitalia. Option B, the beginning of differentiation in the fetal groin. Option C, the fetal testes are descended into the scrotal sac. Option D, the internal differences in different gender become apparent. The correct answer for this question is option A, the appearance of the fetal external genitalia. Now let's move to the rationale. Between weeks 16 and 20, the external genitalia of the fetus have developed to such a degree that the sex of the fetus can be determined visually. Now, in my presentation, my reference book have used SAUNDERS Comprehensive Review for the NCLEX-RN examination 9th edition.